Hi, everyone. How many of you recognize that thing? I hope I'm not one of the oldest in this place, otherwise I'll get depressed. This is an IBM XT, and it was one of my first encounters with computers at a very, very early age, actually. And ironically, it was in a movie. So I was watching this random movie. Of course, I can't remember anything of it, except for this one scene where essentially a guy was trying to foil a terrorist plot. And the plot was codenamed Operation Orange Grove. I don't know why I remember this, but I do. And in this one scene, he was sitting in front of one of these and typing into what today we would call an NLP engine. So typing questions in natural language about this operation, going, what is Operation Orange Grove? Where is it taking place? Who's involved? How can I stop it? And every time, the computer would respond with exactly the right amount of information in natural language to help him foil the plot. And as like a 4 or 5-year-old, I was sitting there going, wow, I want something like that. I really like this. I want a smart machine with which I can converse the same way I converse with a human being. I wanted to understand what I need and give it to me at the time that I need it. It was basically like my imaginary friend, but it was a digital and smart imaginary friend. Roll forward a few years, and I actually did get my first computer. And sure enough, the first thing I typed into it was, what is Operation Orange Grove? And of course, the super smart response I got was, bad command or file name. So that was a bit of a bummer. I don't know how many of you got that reference, DOS, back in the 80s. And so but the notion of intelligence being the killer app for computers always stayed with me. I was never really excited about, word processing or spreadsheets or enterprise applications or even games and graphics. I wanted a smart machine. I wanted my imaginary smart friend. And when I started thinking about what I'd want that friend to do, I came up with 3 things. I wanted to fly spaceships, I wanted to manage my home, and I wanted to replace my doctor. And so I thought, OK, well, I've got to work in one of these things. And I ended up working in number 3. And it's very interesting because if you're going to replace a doctor with a machine, you'd better understand what that doctor does first. And it turns out that doctors are pretty multi-skilled individuals. So if you look at what a doctor does on a daily basis, it's a multitude of things, really. They build medical knowledge. They interact with patients, hopefully in a language that the patient can actually understand. They build relationships across the medical community to connect with others. They apply medical reasoning to come up with triage and diagnostics and treatment options. And they learn. They continuously learn and improve themselves and do better next time. And it turns out that if you're trying to map that to a typical AI platform, the mapping is actually pretty straightforward. Because an AI platform can have a knowledge base that contains annotated text from medical research and references. It can have an NLP engine that can both understand and generate natural language. It can have connections and graphs and pull in from different data sources. It can apply logic through things like PGMs, for example, probabilistic graphical models, to come up with things like triage and diagnosis outcomes. And it can also have machine learning modules that will constantly improve and expand those models. So we said, OK, that sounds pretty straightforward. Let's try and do that. And we did. Let's see it in action. By the way, this was done for our CEO. So if you hear it saying Ali, Ali, just pretend I'm Ali. So, hey, Babylon, I have a headache.
I'm sorry you're feeling unwell. Try not to worry. Headaches are really common and they're normally easy to treat. Are you happy to answer a few more questions?
Sure.
First things first, have you hit your head recently?
No.
Well, that's good. Where's the pain?
It's everywhere.
Okay, and how did the pain start?
Gradually.
I see. So how would you rate your pain at this moment, where 10 is unbearable?
It's around 5.
Right. Just a few more questions and we'll get this sorted. Have you had any dizziness?
Nope.
Is your head painful to the touch? Try touching your scalp or your temples.
Nope.
And have you had a fever?
Nope.
Have you experienced any nausea or vomiting?
Nope.
How has your eyesight been? Have you had any of these problems?
Nope.
Okay, we are almost there. Have you had any of these?
Nope.
How are your symptoms progressing?
They're stable.
And how long has this been going on for?
About 2 hours.
So the good news is your symptoms don't seem worrying on a medical level, and you can probably manage this yourself. It sounds like yours is a tension headache caused by tension in the muscles of the head and neck. Take some painkillers, but please don't exceed the recommended dosage. Relax, make sure you get enough sleep, stay hydrated, and eat regularly. Finally, if this carries on or keeps happening 5 to 7 days a week, speak to a GP. Regular pain isn't good and can mean something more serious is wrong.
So that's a little bit close to my imaginary digital friend. Of course, there's a high-tech option that's voice-activated, and there's a low-tech option where you actually click on the buttons. I kind of did both, because I don't think it can pick up my voice here. But the thing is, this thing just went through around 13 billion combinations of symptoms and possible disease outcomes. 13 billion, right here in my pocket in under 30 seconds. That's pretty impressive. I didn't have to leave my seat. I didn't have to go to a hospital and be stuck there for 6 hours. I didn't have to book a GP appointment. I didn't even have to talk to anyone. But actually, if I'm the type of person who likes to talk to people, then I can go ahead and book an actual consultation.
Okay, here is the next available GP appointment.
So if I go ahead and book it,
That's great. Your appointment has been booked. I will remind you when it's time, but make sure you have somewhere private lined up so you're ready.
and when it's time for my appointment,
Hi, Ali. Your appointment is starting in 5 minutes.
and I can go through the actual consultation, talk to the doctor, discuss the problems, and when it's over, I can rate the doctor, and I can also get access to a whole bunch of information that normally I wouldn't get from a real GP consultation. Like, for example, all of the notes from my consultation, including the history I shared, examination details, prescriptions, outcome follow-up options, and so on. I can go back and rewatch the entire session if I want to. And I can choose to get my prescription sent either to my local pharmacy or to me at home directly. And there's a whole bunch of other options in this that we won't go into detail into, but actually a version of this is already available in the App Store. Lots of people are using it, and we have a much better version coming up next month. But the real question is, after we're done with this, is really how do we, or why? Why should we do this? Why is this a good idea? Franz helpfully mentioned AI being a very controversial topic, and it is. And the first question on everyone's mind is, why? Why do we need to replace humans with machines? Why do we need to invest so much time and money in creating something like this when we already have perfectly good doctors? Well, let me give you a couple of examples. I grew up in Egypt, and the healthcare system there is, let's say, slightly more flexible than in Europe. Which means that as long as you can afford it, if you're sick, you can go see a specialist directly. The problem is, if you have 5 symptoms, and you go see 10 different specialists, you'll likely end up with 7 different diagnoses. And then it becomes a guesswork as to which one you go with. Do you go with the one that your friend recommended? Do you go with the one that smiled the most, the one that inspired the most confidence? It's difficult, and it's a heck of a gamble to take with something as important as your health. So as a patient, you feel very disempowered. You don't know what to do. But even in the UK, where I live, It turns out that around 1 in 5 people can't get a GP appointment at a time that suits them. 1 in 8 people get misdiagnosed, and hundreds of people die each year from complications due to misdiagnosis. So it's not a trivial number, and that's not even talking about the wider world in poorer countries where often up to or more than 50% of the population have zero access to healthcare. They all have access to mobile phones, but very few of them actually have access to healthcare when they need it. It's a very big problem. But actually, that's only half the story. Because if we think that solving healthcare means that we'll give people access to doctors and information, and even to triage and diagnostics in an automated way after they get sick, then we're really solving the wrong problem. We're solving sick care, not healthcare. We're solving the second half of the circle, not the entire one. Because if I think back to my digital imaginary friend, I want him to do much more than that. I want him to predict that I'm about to get sick before I even start showing any symptoms. If I'm asthmatic and I like to run marathons, I like him to predict my susceptibility or my chances of getting an asthma attack while I'm running and help me reduce that risk. If my mother was diabetic, I want him to tell me my own risk of developing type 2 diabetes. And you can remember all the figures that Franz quoted. And I want him to tell me how to prevent that from happening. Because as he said, in many cases, it's actually preventable. I want to be empowered. I want real personalized medicine in my pocket. I don't want to have to go book a GP appointment a month in advance, then be told that there's nothing wrong with me and to come back when I have some symptoms. And I certainly don't want to Google it and find out that inevitably, no matter what my symptoms are, I'm definitely going to have cancer. I want to be in charge of my own health. And it turns out it's not just me. So France actually had far more impressive figures than these, but I'm just going to focus on chronic diseases where 38 million people a year die from complications due to things like type 2 diabetes, cardiovascular disease, and other chronic diseases. Can you imagine the number? 38 million people? That's an entire mid-sized country wiped off the face of the earth every single year because of chronic diseases. While actually evidence shows that many of them are preventable. Now, are we going to solve everything? Are we going to save everyone? Is that number going to go down to 0? Probably not. But let me finish with a story. If any of you have ever been to Goa, it's one of the most fantastic places on Earth. It's very beautiful, nice sandy beaches, crystal clear water, endless sunshine. But there's a problem. Every day, the tide comes, washes up thousands of starfish onto the shore, the sun bakes them and they die. A little girl walks over to the beach one day, picks up one starfish, throws it back into the sea. A man sees her, walks over and says, "Hey, little girl, what are you doing? There are thousands of them in there. You're not really making a difference." And she said, "No, but I've just made a difference to that one." So I think our challenge to all of us should be, how many starfish can we save? Thank you very much.